Thank you for a kind introduction, and thank you for a warm welcome from all of you who are members of this community of a conference. As a citizen of the United States, I appreciate particularly having my country referred to as your neighbor to the south, as opposed to other ways it's sometimes referred to, both within and outside the United States. I'll say that I have one comment to make about legitimacy this morning, and that is that I will confess to having today absolutely no situational legitimacy on the question of health and well-being, but hopefully some strategic legitimacy. No situational legitimacy because my experience of getting here yesterday was, let's just say, complicated. And the combination of Delta Airlines, Alaska Airlines, Air Canada, and WestJet. 5 different airports and 3 different trips through security screening and arriving about 6.5 hours later than planned is an interesting example of the contrary of well-being, actually, which is why situational legitimacy feels a challenge. On the other hand, strategic legitimacy, I think I can offer from the perspective of how the topics, ideas, feelings in this conference translate back into the universities which are intended to be health promoting. And Claire and Martin asked me to talk specifically with reference to the universities themselves, which I will do in this next 40 minutes or so, within a broad framework strategically of how we think about health and what it might mean to promote it. As I do so, I notice the flowers in the room. I notice that we are in still a room, and I take you back for a moment to where we actually are. Where we actually are is in this place, and I encourage you for a moment to, as you look at the slide, to do so beyond the 2 dimensions of the picture itself. I invite you for a minute to go into this slide remembering what it was like when you were there. The there doesn't matter that this is particularly in British Columbia, which it is in the photograph, but when you were there in nature, when you heard the wind in the trees and felt the rustle in the water, when you wondered what that was that you heard behind you, when you looked up at the sky, when you were in that place, felt some connection to this earth, to its creatures, to its mysticism, to its magic, when you felt you were well. In that moment when you felt you were well, when you were part of this marvelous thing on which we live, with which we commune, with which we have responsibility, notice particularly where we are in that place here in British Columbia, because we are not on any land. We are on Indigenous land, surrounded by tremendous numbers of Indigenous peoples and tribes and history and legacy, inspired and enlightened by their art, amazed by their persistence, enlivened by their legacy. And part of the legacy of this place has been brought into our universities here in Vancouver, in Victoria, Simon Fraser, and other universities in Western Canada, and across, in fact, through Canada, through the First Nations houses. And notice how they bring into the place the outdoors. Notice how they bring in the trees, the totems, the house posts. Notice how they bring back into the university itself the place in which that university is situated and planted. As you think about that, think for a moment about what that means and what we're doing today. Because we're in a place where we're conscious of land and nature and spirit and wonder and the senses that it takes all of us to understand and be part of that planet and these creatures. At the same time, we spend most of our time thinking. Most of our time with words, most of our times with ways of trying to come up with a description. What words would you apply to this? What words adequately describe what it was like when you were in that place that we looked to before? So the caution symbol at the bottom of this sign is about that translation or the inadequacy of it. That what it means to be well, what it means to be healthy, what it means to be part of a planet that's healthy is hard to put adequately, accurately into words. Hard to put into the papers and framings. It's the biggest challenge, I think, for this new charter. Is how to say in a charter what we mean about what it is to be healthy, what it is to promote health, what that's like in a world that is currently profoundly not healthy. How do we say that? Well, what I'm going to talk about is part of how we say that, the heart of it, in some words. And some of those words are these. I'm going to talk this morning about a view, a policy point, which is that health and well-being don't come from systems or organizations or services. We can put all the systems, organizations, and services in place we want to, and they will not necessarily make us well. We also have roots of health and well-being that grow from fundamentally human and natural places and connections, care, community, capacity, and peace. That's what leads to the emergence of well people, of integrated persons, of people who can promote health in themselves, in their universities, and in their world. To do that, we have to change things. We have to change culture. We have to reclaim what is human. We'll talk a lot about that. It's hard to talk about it because the words don't work well, as you'll see. But we'll try to talk about reclaiming what's human, focusing priorities, investing in something that I like to call deep prevention, which doesn't mean just changing your behavior on the surface to match the metrics of some intended government regulation. Deep prevention means something much more profound than that, and it will require revolutionary thinking. It will require a new charter, which we're doing. It will require exquisite resistance. Exquisite resistance. We'll talk about that too. And it requires new cultural capital, remembering that health is not healthcare, students are not consumers, and corporations are not people, regardless of the view of Republicans in the United States. Now notice how different this felt from that. Now go back to this for a moment. Notice the difference between the words and the place and where you were at one time. And then we're going to go back to the words, but we'll come back to this. So, 4 premises to guide this conversation this morning. First premise is what the core problem is. And the core problem is we are misleading ourselves. We have been misled. And we continue to do that about what health is, what it means, how you know it when you see it. That is, how it's defined, how it's recognized, how it might be measured. We can't promote health in universities. We can't be health-promoting universities if we don't know what it is, can't define, can't say what it looks like when we see it, that we're trying to promote, and we can't tell whether we promoted it unless we know what it was so we can see it when it does. So we're going to talk a bit about health, what that might be and look like, and we're not going to descend simply into the rhetorical arguments about does health mean physical or mental or this or that. We waste our resources on those arguments. If we think about health broadly, then we go to our second premise, which is that because we're dealing with universities and health-promoting universities in particular, that health is connected to learning. Learning is a complex activity that engages our whole being. The idea that learning is about the intellect alone is misguided and wrong. Learning, in fact, engages the whole person, and that depends, because the whole person is involved, on health and well-being. Broadly understood, defined, and experienced, not just this or that, but comprehensive, holistic well-being, individual, integrated person. If we want to remove or reduce or eliminate barriers to learning, then we have to advance the concept of health. We have to become health-promoting universities within ourselves, not just toward the world. That is, to advance students in their future, in their learning, and their success, universities have to promote their health, remove barriers to their learning, and universities ought to be accountable for doing that. Third premise, ethic of care. As human beings, we're bound together. Look what happened earlier this morning. Martin suggested that you connect and reconnect, and before he even got the words out of his mouth, you were back binding together, back connecting, back being part of something bigger than ourselves. We are wired, genetically prepared, evolved to do that. We're parts of communities, we're bound together, and among us there's an ethic of care, and among us who are a university, that ethic of care requires that we respond empathically, competently, capably to factors of all kinds that affect the well-being and learning of students. It's important but not sufficient for that to come from a few people. So we don't discharge our obligation as universities to care about students because we have a dean of students who takes care of them, or because we have a counseling director who provides them services, or because there's a health service person who organizes clinical care, or because there is one particular faculty member that students have learned they can go to. That does not discharge the university's obligation. That simply speaks of the value of an ethic of care in persons, but that same ethic in a human organization applies to the organization itself, so universities should also be accountable for this. They must promote health within if they are going to be part of a change in the world to promote health outward. Last and fourth of these premises, none of this will be possible without new investments. None of this will be possible without ethical, caring, and value-laden attention to community, environment, society, and culture. Has to generate new cultural capital. And any charter that we write will fail if it doesn't stimulate the investment of new cultural capital to support health. Well, those premises suggest then, let's go back to the first one that we've been misled, some important points about health itself. I am a physician. I've spent much of my life and career as a, I think, pretty good healthcare provider, providing health services, taking care of people medically, helping them thrive physically to the extent that I could, mentally, emotionally. But I have no delusion that that's where health by itself is found. In fact, health is not produced by the army of our apparatus, our facilities. It is not produced by the industrial or organizational or institutional characteristics of healthcare systems, and it's not produced or measured by the tools of those systems. Health, in fact, arises elsewhere. It arises from something deeply human about that connection you looked for this morning, from something natural and real, what you felt when you sat in that place that you looked at. Health arises from things that were there before our technologies, before our words, when we thought relationships were not established on Facebook. Health arose sometimes when we could talk to each other, perhaps even before we knew the full words with which to talk to each other. Health doesn't arise from texting. Health doesn't arise from the vacant approvals we seek. Did somebody like what we said, or heart it, or focus it, or retweet it? None of those things that we think of as making ourselves feel valuable have much to do with what it is that makes us healthy. Turns out that we've also been misled about learning. Health and learning intricately connected, and learning is not about hours and courses and credits and credentials. It's about engagement. It's about transformation. The most challenging thing that you can say in the United States right now is that a student shouldn't be the same when he or she leaves college as he or she was when they started. It's the most challenging thing you can say, because there's so much debate about what it is universities are supposed to do, which is to give you a degree. so that you can get a job. It has very little to do with what happens to you or what you come out as, having started as something else. Universities themselves also have been and are misleading. In fact, universities shouldn't think of students as consumers or revenue units or sources of next year's budget. Students are more complicated partners in an educational enterprise. We are, as universities, people bound together. Even the thing we call administration in universities turns out to be us. So when we say the faculty never, or the student affairs people won't, or the administration didn't, that means we didn't, or we won't, or we haven't. Learning, health, deeply connected, health-promoting universities have to think about learning and health and understand what both of those things are. The enemies of health and learning are the same. Enemies are the same things. Thinking health is healthcare, thinking learning is about credentials, depersonalization, taking the human out of learning or the human out of health, distancing ourselves from what's happening around us, about us, losing our ethic of care, forgetting who and where we are, so that we don't notice the internal or environmental or academic landscapes that surround us in a challenging world. We are in intimate reciprocity with these landscapes. We sit by the stream, put our feet in the water, listen to the wind, touch the tree, and the tree in its way is touching back. And as we've lost our connection to the things that are most profoundly natural and human, we become so abstracted, so dependent on ideas and words, that we've lost track of what it means, in fact, to be a healthy, learning human person. This concept is particularly well evoked in David Abram's work, an ecological ethicist, whose books, beginning with The Spell of the Sensuous, include language such as this: caught up in the massive abstractions, our attention hypnotized by human-made technologies that just reflect us back. Vacant approvals. Just reflect us back to ourselves. Our senses become adjuncts of an isolated, abstract mind bent on overcoming organic reality, which is that we are mammals who will live and die. And no amount of health and health care, no amount of health promotion will keep us from being mammals who will live and die. But we can be humans who will live as mammals and die in a healthy way. Well, this abstraction that we're talking about is one picked up in the thoughtful minds of feminist philosophers, such as the ones who combined to write this manuscript, For All We Care, about self-care, noting, and I can vouch for this after my experience yesterday, by the way, it's hard to be a healthy mammal in our culture. Turns out it's hard to be a healthy mammal on Delta Airlines. But anyway, it's hard to be a healthy mammal in our culture. We live in environments that our nervous systems can barely handle on a good day. Think about that. We live in an environment that we can barely handle on a good day. We work, study, socialize in poorly ventilated, enclosed spaces. Happily, we have these flowers. Enclosed spaces with sharp corners and flat walls that make us feel entrapped, unable to escape. Our brains, which are stimulated by a relentless flood of inconsequential sounds and images, dredge through the news of ever-increasing tragedies and risks and disasters. And in the midst of all of that, we are supposed to stay calm, balanced, and productive. As we were landing, 7.5 hours later, by the way, in Seattle last night, the flight attendant said, "Hope you've enjoyed your flight." No, not really. But we're supposed to stay calm, balanced, and professional. We're supposed to be productive no matter what, to ignore, to forget, to distance ourselves, to take ourselves out of it. And we do this to students every day. We do this to students every day. We hold them accountable, responsible for their own everything, ignoring the influences of culture, societies, and values, universities, institutions, organizations around them, an environment that's declining, as these students grow up to be the next version of us. This is wrong. This is wrong, and it introduces the concept that things can be wrong and can be righted. This comes from the Book of Common Prayer of the Episcopal Church. It's in the General Confession of Sin. It says, we have left undone those things which we ought not to have done. We have done those things which we ought not to have done. There is no health in us. There is no health in us because we have not done what we ought to have done. We have done what we ought not to have done. And this idea that somehow health has something to do with what we do and who we are, something more important and transcendent than what our cholesterol is. This idea that health is something about who we are and what we do is essential to the idea of what it would mean to promote health in a university or elsewhere. And this idea that somehow there's no health in us means that things are actually wrong. Some things have actually been done wrong, that things could be done differently, introduces us to a broader idea of what being healthy would mean. Maybe being healthy would mean doing what we ought to do and not doing what we ought not to do, like this. The idea that doing this is wrong has recently acquired tremendous global interest because of this man. In the papal encyclical Laudato Si', he defines something called ecological sin, noting that human complicity in climate change is a sin both against the earth and against its poorest inhabitants. It is a sin. In the church's sense of sin, it is wrong. This means that some of us, many of our universities, are sinning. That universities are complicit directly or through their investments in this sin. If they are not truly health promoting. So a health promoting university cannot be a university that invests in fossil fuels. A health promoting university cannot be one that misuses students, blames them for things which have social and cultural constructions beyond them. That is not a health promoting university. Health promoting university cannot be one that fails to respond to the challenges to well-being that affects their students' ability to learn. Health promoting university cannot be one that abstracts students from themselves. So what do we do? How do we promote health? What might it be? The monastics, the mystics in the 15th and 14th century defined being healthy and promoting health as something that was both inward-facing and outward-facing, something that identified the individual and the community, that thought about sustainability and justice. All of those words, they said it in Latin, ora et labora, to pray and to work. To pray and to work, to do something in yourself and beyond yourself, to be part of something larger, whatever you think the aura prays to pray, to be outside yourself, and to work, to be capacity, to have capacity to do things, to be effective, to do what you ought to have done, and not what you ought not to have done. Freud, later on, modified it to say love and work, but he meant the same thing. That to be healthy is to go outside yourself, to be in relation, and to be able to do things in yourself. These, Freud writes, are the cornerstones of humanness. They are the cornerstones of what he thought it meant to be healthy. They ought to be the cornerstones of what health-promoting universities try to do with students. Help students pray and work, love and work, be in and outside of themselves, not simply get degrees, not simply be ready for the next standardized test, not simply themselves, but part of something else. Another definition of health advanced in the 1960s and 70s in the United States was wholeness unfolding. Comes from the profession of nursing. Nursing, a distinguished and elegant view of the world. And in nursing's view of the world, ways of thinking of its practice, health is wholeness unfolding, defined in relation to others. The individual unfolds, the community unfolds. Concept arose from the riots in Detroit in the 1960s, where the single surviving building was a child's health care and play center run by nurses. Everything around it was burned. Center was not. It was at 9226 Kercheval Street in Detroit, hence the name of the book and the reference. But once again, health has something to do with you and the world you're in, you and the community. Health has something beyond yourself, and we're not there yet. In Baltimore this year, in Charleston, South Carolina last week, in the world in 2015, we are not there yet. We think, our friends in corporations think, that the way to be healthy and well is this: skinny jeans, mini skirts, crop tops, short skirts, bikini stairs, fun, satisfaction, confidence, health, and happiness. Really? Really? One of your colleagues, writing in an elegant paper in Health Promotion International 2.5 years ago, noted the problem. Despite evidence that public policy that equitably distributes the prerequisites and social determinants of health is a worthy goal, progress in achieving that has been uneven. Note the especially in nations where the business and corporate sector dominates the making of public policy. So it is that things change slowly. So it is that in the United States, the Confederate flag still flies over the state capital of South Carolina. So it is that we still sell trans fats despite 20 years of evidence of their destructive potential. So it is that it took 40 years to make cigarette smoking illegal interior spaces in most of the US. So it is because health is not what's promoted. There's nothing about this which is health promoting. It says for your health, for your happiness, for you. What happened to the rest of the people in the first place? For you. And health and happiness is about skinny jeans and stairs and bikinis? Really? What happens 10 years later? One of the more educational moments of my life, one of my children, as we were walking through a department store and I passed by a table in which they had a sale on men's underwear, along with a photograph of some dynamically attractive gentleman wearing said underwear. And I picked up a box of said underwear, was looking at it for a minute, and my son, in perhaps the most useful thing he ever said to me, said, "Dad, do you really think if you buy that you're going to look like him?" Thank you for that. So. Well, to do what we ought to have done then requires at the base of our pyramid of actions enormous culture change, thinking, acting, and working differently. These kinds of pyramids, which always include direct services at the top, and then surveillance and monitoring in the middle, and then public education next. The actual bottom of these is actually about culture change. The actual bottom of these is that society, culture, values, how we think about health, how we think about learning, how we understand students, all of that has to change if we are going to become truly health-promoting people, organizations, societies, universities, and cultures. So with that in mind, what do? We think differently, we do differently, we work differently. We think differently. It turns out that what you have the right to do is not always what is right to do. and having the right to own and carry guns or conceal them, to cause earthquakes by fracking, to become dependent on carbons at the extinction of species in the earth, to make ridiculous profits, to have CEO salaries in universities as well as corporations, which are outrageous, to economically enslave hourly and small service workers, to demean and diminish students because we have power over them. All of those things are unethical. All of those things are wrong, and having the right to treat a student badly doesn't mean that it's right to do it. Human ethical care has to be thought differently, that we pay attention, we have responsibility as interdependent beings looking beyond ourselves as well as into ourselves. There's an institutional ethic of care that parallels that, and the obligation of universities to respond not just notably but effectively to challenges to well-being and health, not just to provide assistance through services, but to recognize and change the factors that create or sustain the need to provide those services. And until universities do that, they will not be health promoting. Universities can provide as many services they want, mental health services, physical health services, wellness, health prevention, all these things. But until they challenge the factors that make those things necessary, they are not health promoting universities and colleges. Until that's done, that's their obligation, that's their accountability. That's thinking differently. Doing differently means things like these. It means defining positive goals, not the absence of negative ones. We are too likely to judge the effectiveness of health promotion by how many people no longer do something. Suppose we judge the effective health promotion by how many people did do something. Resiliency, flourishing, strengths, assets. If we do differently, we have to restructure institutional investments on human goals and health-promoting outcomes. That means, yes, divestments. That means investing someplace else. That means the endowment of the institution should not operate in an ethical world that's different from its principles. Humane, and empathic, and responsive internal and other systems. Am I okay? No. I don't know what's happening. I'm still on. Try the microphone by the okay. I'm going to, you know what I'm about to do is exactly what I've said you shouldn't do, which is that I am now standing away from you. And what I intended to do was to kind of be part of you as we have this conversation. Probably the battery ran out, I would guess. But it's all right, we're almost done. So I was part of you and just imagine that this is not here. Just like you imagine that that deforested area is not there. Imagine that you can still remember what it was like when I was out there a minute ago. So on this list are things beyond services that we need, not just services, we need a network of humans in interdependent spaces on campuses who provide what a colleague of mine has always called a web of caring, a place that students and others stick on their course of the way toward well-being and health. All of this takes culture change, social justice first, perhaps and foremost. There will be health for none of us when there is not health for all of us. There will be no well-being for any of us absent social justice. This ethic of care we've talked about includes doing challenging, uncaring, and unethical behaviors, whether that is a professor who demeans a student in class or selling trans fats in a campus store. None of those things are ethical, and they require challenge. We should be valuing students and ourselves and others as human beings, not human doings, not based on what they did or what they achieved, but on who they are and what they're about and what they have done and how different that is from what they ought to have done. We should be civil and respectful. And in universities, perhaps most importantly, we have to remember that excellence and virtuosity are compatible with kindness and caring. It is possible to have a spectrum of intellectual achievement without having a spectrum of decency. It's possible to have a spectrum of virtuosity, to have the occasional student whose PhD in astrophysics leads to solving of the previously unaddressed mathematical proof, and the student who goes back home and because of her experience at university re-engages her people but never gets in the newspaper. We have to have a spectrum of virtuosity, a spectrum of kindness, a spectrum of caring, a spectrum of outcomes that's about justice as well as it's about universities. And finally, we can work differently. Making learning the top priority means that we make health and well-being a top priority. And doing that means that we have to make significant non-incremental changes. So I hope our next charter doesn't suggest incremental changes. Because what's needed in universities, what's needed to be health promoting, is in fact non-incremental, significant systemic, social, and cultural change. And until we will no longer tolerate the deforestations, the animal extinctions, the riots in cities, the inequities of economics, until we will no longer tolerate those things, we will not have justice and we will not have health. And on campuses, until we will no longer tolerate demeaning treatment of students, we will no longer tolerate this lack of a spectrum of outcomes, until we will no longer tolerate the existence of challenges to their well-being that impair their ability to learn. Until that happens, we will not change to become health-promoting universities. There can be health in us. There can be health in us, and in my last few moments with you this morning, I want to say a little about that. Because a common question that I get, or you will get, is from students who will say, what do I do? What ought I to do? What ought I not to do? What ought we to do? What ought we not to do so that there is health in us? First, remember where learning and health come from. They come from care, community, capacity, and peace. So seek care, give care. Seek community, give community. Build capacity, become able. And be at peace, support the peace of others. Through an ethic of care, invest in what happens to the self, to others, to community, to creatures, and to the earth. And desist fundamentally from indifference. A sturdy New England poet whom I know has written a poem about indifference I'm going to share with you. Mark Doty's poem is called Coastal. The picture in the background, by the way, is of something called Long Point Light. It's a lighthouse at the very tip of Cape Cod in Massachusetts, where I live. And his poem is about this area, about the lighthouse, and about a little girl. Mostly, it's about what it is to be healthy, which is about not being indifferent. He writes, cold April, and the neighbor girl, our Pluma's daughter, comes up the wet street from the harbor carrying in a nest she's made of her pink parka, a loon. It's so sick, she says, when I ask. Foolish kid. Foolish kid, does she think she can keep this emissary of air? Is it trust or illness that allows the head, a sleek tulip, to bow on its bent stem across her arm? Look at the steady, quiet eye. She is carrying the bird back from indifference, from the coast of whatever arrangement the elements intended, and the loon allows her. Stubborn girl. Desist from indifference. And then walk, move, beyond the earth more than in the gym. Feel strongly. Go ahead and lose balance. It's okay. It will be all right to be over-enthusiastic. It will be okay to notice. It will be okay to sense and see what happens around you. Escape what's comfortable. Escape what's comfortable on Delta yesterday, there was no chance because it would be in fact, flying isn't to escape what's comfortable. Love and work, have connections, but also challenging ones, not just the ones that reinforce you. Resist exquisitely. Resist exquisitely means don't be swept up in that bikini, that swimsuit, those trans fats, those images, those ideas. Don't be swept up by what it matters or not to have X number of followers on Facebook. Don't be swept up. Resist exquisitely. And then embrace the cycles of life and ask the big questions. Emily Dickinson, another New England poet 150, 60 years ago, wrote, "Because I could not stop for death, he kindly stopped for me. The carriage held but just ourselves and immortality." The carriage will come. And because the carriage will come for all of us, being healthy also means asking and answering the big questions. The big question, in the words of a third poet, Mary Oliver, simply this: tell me, what is it you plan to do with your one wild and precious life? Notice her words, wild and precious. Notice her words, one. What would you do with your one wild and precious life? And in answering that question, her other poem, perhaps her most famous, Wild Geese, provides the answer. So when students ask you, what do I do? How does a health-promoting university help a student find health and well-being? Above all, it will say, you do not have to be good. You do not have to walk on your knees for 100 miles through the desert repenting. You only have to let the soft animal of your body love what it loves. Tell me about despair yours, and I will tell you mine. Meanwhile, the world goes on. Meanwhile, the sun and the clear pebbles of the rain are moving across the landscapes, over the prairies and the deep trees, the mountains and the rivers. Meanwhile, the wild geese high in the clean blue air are heading home again. Whoever you are, no matter how lonely, the world offers itself to your imagination, calls to you like the wild geese, harsh and exciting, over and over announcing your place in the family of things. That is health and well-being. And if we can figure out how to promote that, how to make it possible in our universities day to day, hour to hour, and in long-term outcomes, to remember that you have a place in the family of things, and you are in a family of things, that you do not have to be good, then we will promote health. So back to the words and the heart of it that we've talked about this morning. What I've tried to say to you is health and well-being don't grow from systems, organizations, and services. That the roots of health and well-being arrive from very human conditions, which are linked to those wild geese and to that place in the first slide. That those conditions nourish what it is that we want for ourselves and our students as health-promoting universities. That to change culture is necessary. That reclaiming the human, refocusing priorities, investing in deep prevention are essential, and all of that will require revolutionary thinking, exquisite resistance, new cultural capital. We will remember health is not healthcare. We will remember students are not consumers. We will remember corporations are not people. We will resist exquisitely. We will notice. We will desist from indifference. Thanks very much. Good to be with you this morning.
Might have time for a couple of questions or comments if anyone would like to come forward. We do need to have you come forward to a microphone. We have one on this side. We'll have one on this side. As you know, we are live streaming this talk and our plenary sessions today to the world. So we have an online audience as well as people in the room today. Does anyone have a question or comment that they would like to say at this point? Martin, thank you.
Hi, thank you for that. Is this on?
Yeah.
Okay, wonderful. What has been your experience using the words kindness and caring in academic settings?
The reaction is usually unkind and uncaring. No, actually, this is a sort of glib answer, but I think the serious answer is that, as is true about health or learning or well-being, we have to define terms. And people misunderstand kindness and caring to mean no standards, no rigor, coddling, taking care of students on issues where they should have been prepared already, and all those kinds of things. And they confuse kindness and caring with a lack of respect for virtuosity or intellect or success or particular kinds of achievement. They're not opposed. And my experience, including recently, 10 days ago at UBC in Vancouver, not very long ago in Victoria, was that when you talk about an ethic of care in a frame that relates to human interdependency and to how it enables students rather than how it coddles students or disagrees with institutional priorities, that even the most initially cynical people tend to respond well. Now, whether anything gets done is a different question.
Great.
Thank you for that. That was very powerful. On the topic of kindness and care, how would you place the system of publish and perish, research grants at all costs, hyper-competitiveness over grade and tenure? Where's the kindness and caring in that?
Little. And promotion and tenure criteria, remember, are how our graduate students learn what matters. Graduate students, having learned that that's what matters, teach undergraduates that that's what matters. Undergraduates teach each other that that's what matters. And it is, as a student at the University of Vancouver, University of British Columbia, Vancouver, said to me 10 days ago, in the setting in which there is so much competition and we look upwards and see it among professors cutthroating each other, taking each other down, demeaning their graduate students, the graduate students do that to each other. In a setting in which that's happened, why do people yell at me for cheating? I'm doing what is the cultural norm. I'm just trying not to get caught. And the problem with most of our systems is, this goes back to the issue of the radical need for cultural change. You can assess people's academic virtuosity toward promotion and tenure in ways that are not hyper-competitive. You can create systems which are kind in recognizing differences in the capacities and capabilities of professors around the spectrum of teaching, service, research, and scholarship. You can recognize those differences without having to take people apart in the process of doing so. And it's a challenge, I think, for academic committees and academic policy to look quite seriously at whether those current policies actually advance the kind of outcomes they desire, because a hyper-competitive assistant professor will achieve less, I would argue, than an assistant professor who feels valued and supported.
Yes. Would you like to introduce yourself as well?
Irena Misevičienė from Lithuania. Thank you very much for your thoughts. Would you give such presentation 30 years ago? What would be the accents?
Well, in the first place, I haven't given exactly this kind of presentation 30 years ago, but the principles were true 30 years ago. And two things have changed. One is that higher learning in the US, post-secondary education in Canada, have become increasingly corporatized. so that the industrialization of higher education has been linked to a change in values and to a change in priorities, where a presentation like this 30 years ago actually would have been more welcome. That there was more of a sense of community about higher learning and about the relationship between institutions and students. That was a time when presidents were academics, when vice chancellors and presidents had risen through faculty ranks and often had had close personal contact with students. That was before the promotion and tenure criteria that we just talked about emphasized hyper-competitiveness. And it was before we thought of students as purchasers of degrees rather than collaborators in learning. So today it's a more challenging argument than it was then. It was also before, by the way, we deforested most of the earth.